Welcome back to Body Beautiful. We are here with Dr. Karen Horton, plastic surgeon specializing in breasts, and we'll be taking your calls about plastic surgery and breast augmentation. Here's the phone number to call, 800-440-4884. And remember, any advice we give you today, obviously, you want to consult your own physician. We also want to let you know, too, that, some of the breasts before and after, there's some graphic pictures here, so just keep that in mind as we go along. You mentioned that this is actually a very special week.
October is National Breast Cancer Awareness Month, so it's very appropriate that we're talking about breast surgery, and one of the options for breast reconstruction is implants.
And that's really very important, because we were talking about this before, and a person that's had a radical mastectomy, it's one of the, I don't know, psychologically...
Breast reconstruction is so important. It will give a woman back her sense of femininity, body image, self-esteem, and nowadays we're able to perform breast reconstruction at the same time as mastectomy. So many women who know that they're facing cancer, possibly chemotherapy and radiation in the future, they can go to sleep, have their breast cancer removed, wake up with a breast reconstruction, and never have to live without a breast.
So that traumatizing element is taken out of it.
It's very rewarding.
Okay, let's talk about some of the surgery that you do, and then what kind of patients do you see? Someone who's seeking breast augmentation.
I see women that are very well educated, many professional women, and sometimes full-time professional moms as well, who are looking to do something for themselves. Breast augmentation can be done before having children, but very often it's done after a woman has finished her childbearing. She has had the experience of having a little bit fuller breasts while she's breastfeeding, and then after breastfeeding, the breasts themselves atrophy or they actually shrink. Also, with age, breast tissue itself can shrink and there can be a droop to the breast.
I have a very good friend who had her breast augmented after having two children, and she said she likened it to a baseball or a tennis ball in a sock. I mean,
we call that rocks and socks, which can happen with aging.
So the mommy makeover is really big.
Yeah, but breast augmentation, sometimes breast lift, sometimes a combination of a lift of the skin and a small implant is part of the spectrum of procedures that we call the mommy makeover procedures. And I see a lot of women like that. The women who are seeking breast augmentation, they're doing it for themselves. It's often after a major life event, a birth in the family, they're finished having kids, a divorce, a death, or they're doing something for themselves.
All right.
So it can be very empowering to women.
We do have the before and after pictures. Let's go ahead and cut to those if we can. Do we have those with us? There we go. Okay, talk to me a little bit about this patient.
This is a woman who exactly fits that demographic. She's in her late 30s. She's finished having children. She has a bit of a natural droop to her breast. You can see the nipple, the position is just about at the inframammary fold, or the fold of the breast. So she desired to have an augmentation. Her goal was to get back to the way she was when she was breastfeeding, when she was lactating, and so she's fuller, however she looks natural. She doesn't want anyone to know that she's had breast augmentation.
So is that what you aim for, just to get a natural look?
The aim is a natural result.
The Pam Anderson,
very few women come in actually asking for that. And most women, they want to look natural. They want to look good. They want to fill out their bra or their strapless dress, but they don't want to look fake.
Okay. We've got to get to some of these calls here. Let's take, let's see, Barbara. Barbara, do you have a question for the doctor?
Yes, I do. I wanted to know, how do you choose your doctor in the matter of cost? Is there a difference between a doctor that's cheaper than the other one and they're both certified doctors?
Good question.
That's a very good question. That's a bit of a loaded question. When you choose a doctor, whether it's a doctor or a surgeon, you really need to choose someone who you like and who you can trust. They should be board certified. Do your homework.
Oh, yes.
Look them up on the internet.
First thing.
See a number of physicians. It's important to not only get one opinion, but a second opinion and a third opinion. And the way you choose a doctor is the way that I choose a patient. Meaning, there has to be a bond which is formed. It's a relationship you're entering into with somebody. So do you like them? Do you trust them? And is that person going to see you through a positive surgery and in the future? I tell all my patients I want to see them every year for follow-up, mostly just for a social visit, and also I want to see how they're doing and how their result is occurring over the years.
And you are offering for the first 20
a complimentary consultation for the first 20 callers.
Okay.
And in terms of cost, the cost of having a surgery like breast augmentation can vary. I would be aware of special deals and bargain basement surgery. You want to go to someone who's reputable, and often there is a standard fee, and if you do your homework, you'll see most surgeons charge around the same price. I would be aware of very discount surgeons. You have to worry that they may not be the same quality.
Well, what about, some people go out of the country to have work done. How do you feel about that?
Again, do your homework. Make sure they're board certified in whatever country that they are in. And sometimes it can be great. You can take a vacation and have a surgery done. I'm not going to bash it, but I think you need to do your homework and be very careful.
Doctor, there is so much we need to talk about, and I have shortchanged our callers. We're going to have you back, obviously. For more information about Dr. KRON Horton, you can call her office at 415-923-3067 or go to womensplasticsurgery.com. And of course, for the first 20 callers who mention the show, Body Beautiful will receive a complimentary consultation. Thank you so much for joining us, Doctor. And join us again 10 o'clock next Monday for another edition of Body Beautiful. Thanks for joining us. Have a great day. For more information about our show, go to KRON4.com and click Body Beautiful. Once there, you can see videos of past shows and get contact information for the doctors we featured, as well as listings for future shows.